When people hear the word cancer, most immediately think of lung cancer, breast cancer, or colon cancer. These are the diseases that often dominate headlines and public awareness campaigns. But there is another type of cancer that doctors frequently describe as one of the most silent and dangerous. A disease that can grow quietly inside the body for months, sometimes even years, without obvious warning signs. By the time it is discovered, it is often already in an advanced stage. That disease is pancreatic cancer. Pancreatic cancer is sometimes called the silent cancer because its early symptoms are often subtle and easy to ignore. Many people mistake the warning signs for stress, digestive issues, fatigue, or everyday discomfort. But according to medical experts, the body often sends small signals long before the disease becomes severe. Recognizing those signals early can make a critical difference. Early detection can significantly improve treatment options and survival rates. So in this video, we are going to explore several early warning signs of pancreatic cancer that many people overlook. Understanding these symptoms does not mean assuming the worst. Many of these signs can also be caused by less serious conditions. However, knowing what to watch for can help you take action sooner if something feels wrong. One of the most common early symptoms is unexplained pain in the upper abdomen that spreads to the back. This pain often begins as a dull pressure or discomfort in the upper stomach area. Over time, it may gradually radiate toward the middle of the back. Some people notice that the pain becomes worse after eating or when lying down. Because back pain is extremely common, many individuals assume it is related to posture, muscle strain, or stress. But if this type of pain persists for weeks without a clear cause, it may be worth discussing with a medical professional. Another warning sign can be sudden loss of appetite combined with unexplained weight loss. The pancreas plays a key role in digestion by producing enzymes that help the body break down food and absorb nutrients. When the pancreas is not functioning properly, the body may struggle to process food efficiently. As a result, a person may begin losing weight without trying. Meals may become less appealing, and the feeling of hunger may decrease significantly. If someone begins losing weight rapidly without dieting or increasing physical activity, it is an important signal that the body may be experiencing an underlying problem. A third symptom that can sometimes appear in the early stages is jaundice. Jaundice is a condition where the skin and the whites of the eyes develop a yellowish color. It can also be accompanied by darker urine and pale or clay-colored stools. This occurs when a tumor blocks the bile duct, preventing bile from moving properly through the digestive system. While jaundice is commonly associated with liver problems, it can also be linked to pancreatic diseases. Because this symptom is more visible than others, it is often one of the signs that finally prompts people to seek medical attention. Another symptom that may surprise many people is persistent itching. Most individuals associate itching with allergies, dry skin, or irritation from environmental factors. However, in some cases, pancreatic cancer can lead to intense itching across the body. This can happen when bile salts accumulate under the skin due to blockage in the bile ducts. The itching may become worse at night and may not respond to common skin treatments. When itching appears without a clear dermatological cause and continues for an extended period, it should not be ignored. Digestive problems can also serve as early warning signs. Because the pancreas produces enzymes that help digest fats, proteins, and carbohydrates, disruptions in pancreatic function can affect the entire digestive system. Some people may experience persistent bloating, gas, or stomach discomfort after meals. Others may notice diarrhea or stools that appear greasy or unusually pale. These symptoms may seem similar to common digestive conditions such as food intolerance or irritable bowel syndrome. However, when digestive problems become chronic and unexplained, they may require further investigation. Another possible early signal is the sudden development of diabetes. Research has shown that some individuals who are later diagnosed with pancreatic cancer first experience unexpected changes in their blood sugar levels. This may appear as newly diagnosed diabetes in someone who previously had no history of the condition. In other cases, people with existing diabetes may notice that their blood sugar becomes unusually difficult to control. This does not mean that every new case of diabetes indicates cancer, but it does highlight the important connection between pancreatic function and blood sugar regulation. Persistent fatigue is another symptom that can sometimes be overlooked. Many people feel tired due to work stress, lack of sleep, or daily responsibilities. But the fatigue associated with serious illnesses often feels different. It may be a deep, persistent exhaustion that does not improve even after rest. People may feel drained throughout the day and struggle to maintain their usual level of activity. While fatigue alone is not a specific indicator of pancreatic cancer, when combined with other symptoms, it may provide an important clue. Understanding these potential warning signs is important, but it is equally important to discuss prevention and lifestyle factors that may support pancreatic health. While no lifestyle change can completely eliminate the risk of cancer, certain habits can help reduce risk and support overall well-being. One of the most important factors is maintaining a balanced and nutritious diet. Foods rich in antioxidants and natural nutrients can support cellular health and help protect the body from damage. Vegetables such as broccoli, cabbage, and leafy greens are often recommended because they contain compounds that support detoxification processes in the body. Tomatoes, garlic, onions, and whole grains can also contribute to a healthier digestive system. Healthy fats such as olive oil may help reduce inflammation and support metabolic balance. At the same time, reducing highly processed foods and excessive sugar consumption can be beneficial. Diets high in processed meats, sugary drinks, and packaged snacks have been linked to increased inflammation in the body. While occasional treats are normal, building daily meals around whole and natural foods can support long-term health. Smoking is another major risk factor that should not be ignored. Numerous studies have shown that smoking significantly increases the risk of pancreatic cancer. Avoiding tobacco products or quitting smoking can dramatically reduce this risk over time. Limiting alcohol consumption can also help protect both the pancreas and the liver from long-term damage. Physical activity is another powerful tool for maintaining overall health. Regular movement helps regulate blood sugar, supports the immune system, and contributes to a healthier body weight. Even moderate activities like walking for 30 minutes a day can have meaningful benefits for long-term health. Consider sharing this video so more people can learn about these important warning signs. And don't forget to like the video and subscribe to the channel for more content focused on health awareness and well-being. Stay informed, take care of your health, and we'll see you in the next video.